I'm Thomas Baldrick at ASH 2014, joined now by Dr. Fortunato Morabito from Italy. Thanks for stopping by.
Thank you.
All right, so we're going to talk about an Italian retrospective multi-center study looking at Bendamustine in combination with Rituximab for previously untreated CLL patients. Why did you feel this study needed to be done?
In chronic lymphocytic leukemia, we actually have two major problems. The first one concerns those patients who have the p53 disruption, which actually up to now deserve some attention in terms of a chemotherapeutic approach, and we hope that the new drugs such as Ibrutinib could give an answer for this kind of patients. On the other hand, we have a category of patients, old patients with some comorbidities, and you know in that cases it's quite difficult to administer combination chemotherapy such as fludarabine, cyclophosphamide, and Rituximab, which is actually still a gold standard for patients with chronic lymphocytic leukemia. However, we have we have some results regarding randomized trial and Dutch randomized trial, in which patients were actually randomized to receive either fludarabine-containing regimens or Bendamustine-containing regimens. And the results are in favor of fludarabine-containing regimens. However, we obtained some results by using a sub-analysis in older patients, and in that category of patients, Bendamustine is absolutely identical in terms of clinical outcomes as compared with the fludarabine, cyclophosphamide, and Rituximab. So what we did was to collect data retrospectively, close to 108, maybe now we collect 200 cases in which we've been CLL patients any age, and with giving Bendamustine 90 milligrams for 2 days and Rituximab. And we collect data, and the results are really interesting. First of all, we demonstrate that all patients could receive safely these regimens. And we get about 35% of complete remission and an overall response rate of close to 93%, with the progression-free survival 2 years of about 87%. That means that we can use this combined with regimens for all patients. On the other hand, this randomized trial, the Dutch randomized trials clearly demonstrate that there is no difference for those patients with low-risk chronic lymphocytic leukemia, such as mutated cases, no p53, and in this case, there is no difference in terms of progression-free survival. So the other question could be, could we choose a low-risk category of young patients who could in some way receive with good results this Bendamustine containing regimens? And what we are going to do is to collect more data to compare younger versus older patients to see whether or not also younger patients could receive this kind of regimen.
What do you think the clinical implications are of what you've discovered?
The Bendamustine and the Rituximab is easy to give these patients. The toxicity is very low. We got only 6% of grade 3 to 4 infection, and about 50% of patients grade 1 to 2 anemia or thrombocytopenia. So it's really safely for patients and easy for the doctors to follow patients on the other hand.
Very good. Thank you, Dr. Morabito. Appreciate your time.
Thank you very much.
Good luck to you.